Hi there, and welcome to Lesson 2.3, Prescription Medication. This is an information-driven lesson as we will address the 70% of Americans who are taking at least one prescription. Furthermore, the bad news is that 20 to 30% of new prescriptions are never filled, and only 50% of that medication is not taken correctly. And the prescribed medications for chronic conditions? After 6 months, the majority of consumers take less medication than prescribed, or stop the medication altogether. The good news is that individuals who understand their medications are able to discuss them openly with their providers, follow the recommended instructions to feel better faster, avoid side effects, and prevent interactions, as well as experience fewer complications. This video may go a little fast, so if you haven't done so already, have the presentation notes in front of you. And be sure to watch the video all the way through for the first time, and then go back to the parts that you need more clarity on. Now, with all of these prescription medication statistics, we are on a mission to show you how to feel more comfortable understanding your medication, so that after you complete this lesson, you should be able to, if desired, take the steps necessary to learn about your prescription and where you should go to learn more. And your lesson takeaways will be to know how a prescription drug is prescribed, have an in-depth understanding of the label and the package insert's anatomy, as well as know where to find out more about medications, drug groups, or conditions. Now, in order to achieve our knowledge goals, this lesson will cover the doctor's 6-step approach to prescribing. We will unpack an example medication's label and package insert, and then we will visit the National Library of Medicine's website. Let's first take a look at the provider's 6-step approach to prescribing. When the patient is in the treatment room, the medical assistant will listen to their chief complaints, evaluate their symptoms, and check vitals such as weight, temperature, blood pressure, and heart rate. Then they will record their assessment. Now, based on the patient's condition, the doctor will then apply the 6-step approach to prescribing. First, they will evaluate and define the problem. They will specify the therapeutic objective or goal. They will consider non-pharmacologic therapies. Afterward, they will select the appropriate drug therapy. They will educate, inform, and instruct the patient, and set follow-up appointments for further evaluation. Now that we got a prescription, let's take a look at the medication's label. On the label, you will find the prescriber's information, the name of the medication, whether it's generic or not, the strength, the dosage, the quantity, and the refills. The label may also include the fill date, the expiration date, and the date that it was picked up. Now let's go into the 11 possible subjects that a typical package insert may include. The package insert will include the description, which is the name, the dosage forms, the pharmacologic or therapeutic class, the chemical name, and the structural formula of the drug. The clinical pharmacology, which is the science of drugs in humans and the optimal clinical use in patients. The clinical pharmacology tells us how the medicine works in the body, how it is absorbed and eliminated, and what the effects are likely to be in various concentrations. In this section, there may also contain results of various clinical trials and studies, and explanations of the medication's effect on various populations, such as children or women. The indications and usage section tells us that the drug has been FDA approved and what it has been approved for, such as migraines, seizures, or high blood pressure. Physicians legally can and often do prescribe medications for the purposes not listed in this section, and they call that off-label uses. In the next section, you'll find the contraindications. And in medicine, a contraindication is the condition or factor that serves as a reason to withhold a certain medical treatment due to the harm that it would cause the patient. A contraindication is the opposite of indication, which is the reason to use a certain treatment. Contraindications list situations in which the medication should not be used. For example, in patients with other medical conditions, such as kidney problems or allergies. Now the next section is the warnings, which covers possible serious side effects that may occur. Now the precautions explain how to use the medication safely, that include physical impairments or drug interactions. Some examples might be Do not drink alcohol while taking this medication, or do not take this medication if you are currently taking MAOI inhibitors. Now, adverse reactions list all the side effects observed in all the studies of the drug, as opposed to just the dangerous side effects, which are separately listed in the warning section. Drug abuse and dependence provides information regarding whether prolonged use of the medication can cause physical dependencies. And the overdose gives the results of an overdose and provides recommended action in such cases. Now, in the dosage and administration section, it'll give you the recommended dosage and may list one or more for different conditions and different patients. An example would be they may recommend lower dosages for children. And in the last section, you will see how the drug is supplied. It includes the dosage form, the strengths, the units in which the dosage form are ordinarily available. It identifies features of the dosage form, such as the National Drug Code, and any special handling and storage conditions. Lastly, let's take a look at the National Library of Medicine's website. The National Library of Medicine is the health consumer's hub for prescription medication information. Simply type in nlm.nih.gov and the website will appear and look like this. All you have to do is punch in whatever you're looking for in this search engine. This is the most transparent website that uses these reliable resources for health consumers to gain knowledge for a specific medication, drug groups, or conditions. And that concludes our video for today. And we covered a lot. But nevertheless, be sure to join me in our next lesson, where we will discuss prescribed durable medical equipment and look at how and why it may be covered or not.